probably done hundreds of liposuction on the local, and it's definitely doable. We give the patient some oral medication to calm them, and then we put the numbing solution here in the area we're going to lipo. And that portion is uncomfortable, but you know, I've only had 2 patients who haven't tolerated it, and that's very unusual. And then we can do the liposuction. The advantage doing it this way is there's no anesthesia, general anesthesia, so there is faster recovery. General anesthesia is very safe, but obviously this is safer. You know, there's still always issues with general anesthesia, even though they're rare. And the key to liposuction is I've made 3 holes for this area. You need to attack the fat from different angles. You can't just get it from one, you know, tunnel. And you know, I always tell, you know, the example I use is getting fat is kind of like beating up a spine until you can get sequence from it. You have to beat this fat different areas, and suddenly it all comes out. And you can see, so you can see I have, you know, the patient is comfortable. I mean, they're not moving. You're alive, right?
Yeah.
Okay, so I want to make sure I'm not, this is not a fake, this is an actual alive patient. We're doing this liposuction. And if she had a lot of pain or any pain, she would be squirming and moving and yelling and screaming, but it's looking pretty good. So at some point I'm going to say, well, I think I have to go and come from here to try to get... But one thing I should mention, there is one limitation to doing liposuction here is that you can't do multiple areas because it does get uncomfortable for the patient lying awake for hours. And also, because we're putting lidocaine in here to numb the area, there's a limitation on how much lidocaine we can give based on body weight. And so we always worry about lidocaine toxicity. So, for example, this patient wanted to do her abdomen too, and I just didn't feel comfortable. I didn't feel we were going to have enough solution to numb her adequately, so we're going to stage it into 2. The patient is agreeable. So that's really the only limitation is that you may need more than one procedure rather than doing everything on the toe. Did I miss anything, guys? Any questions?
Touch-ups.
Oh, touch-ups. Yeah, there's always a touch-up rate with any procedure we do. We can't get 100% perfection. Our touch-up rate for this procedure is about 2 to 3%. So that means if you do 100 liposuction, 2 or 3 may need some touch-ups here and there. I mean, honestly, I don't know why the touch-ups occur, because we try to get the fat out. We spend a lot of time. I don't know if it's nature or just... But they're not as involved as the original surgery. You know, just there may be a little area, a little lump there that we have to go and smooth out, basically. Sorry? What was the question? Well, swelling. Yeah, thanks for bringing that up. Every time we do surgery, there's always going to be swelling. That's just part of the healing process. In this area, I'm going to come on this side of yours. Be careful with that too. Yeah, just look over good. All right, so my goal is to try to give you this little contour here. Go ahead and turn it on. But with the swelling, sometimes you may feel like nothing was done the first 3 months. And I always tell patients is you have to be patient because there will be swelling, and the swelling is going to mask this this contour, you know, that we're going to give you. So it's usually around the 3rd month where you continuously seeing, you're going to see improvement. Yeah, so you have to be patient and trust me, which is difficult to do. No, I'm just kidding. Okay, so what we're going to do, we're going to stop the video. I'm going to take another video after I'm done with this side so you guys can see the difference. Okay, so now what I've done, I've finished this side and you can see the difference. Now there is some swelling now already from the surgery, but I can pinch the skin, and this side I haven't put any fluid or anything. This is without anything. You can see the difference. You see? So, and you can see. I don't know if does the video show this little skating ring. It looks like a like a skating ring. You see the definition here?
Halfway. Yes.
You have this little groove which you don't have there. So we took 650 cc of fat from here. And I used to tell patients in cc, but patients don't understand what cc means. So I use a bottle of wine. So a regular bottle of wine has 750 cc of fat. So we've taken 650 cc of fat. So imagine a bottle of wine almost full of fat from one side. So once we add this side, it's almost 2 bottles of wine of fat from this patient. And she's not really big, but she just happened to have a fair amount of fat here. One question that always comes up is, if I gain weight, will I gain the fat in here? Well, this is permanent removal of fat. We cannot take all the fat cells out, because some of the fat cells are needed under the skin for the skin to survive, for the blood supply. So out of every 100 fat cells, we take about 85 fat cells out. If the patient, let's say, genetically was predisposed to gain weight, and they always go here, or other, let's say her stomach, if she gains weight, it's not going to go there like before. It's going to go in other areas, or maybe hips, or breasts, or neck, or chin. And eventually these fat cells will get large if she gains a lot of weight. So this is not a substitute. I always tell patients, this is just to get you there. It's really up to you to keep good diet and exercise. And these incisions we close. Some doctors leave them open and just leak a lot. I don't like to, just the patient leaks all the time. So we put little sutures here. We take them out in a week. I've never had anybody, in my practice that I had to go and revise the scars yet. They've always healed well. So that's that. Okay, so now we're done with both sides. You can see now here she has the groove, and remember how I could pinch this side before I could barely do that. Now we can pinch it. So, so we're done, and we got 650 cc of fat from here and 600 from here. This is a bigger area, if you can notice, which will explain why we have a little bit more fat. But you can see now they're pretty symmetrical, and she does have that nice contour. All right, we're going to close the stitches, put some dressings on, and she'll be done. Thank you.